What key functions does the pharmacy perform in the treatment of cancer in children?
Okay, the role of clinical pharmacist inside 57357 starting from the protocol development to outcome research. The department of the clinical pharmacy inside our hospital is very important and is very specific and specialized in Egypt and in the Middle East, because we have more than a role of clinical pharmacist or just dispensing or rounding with the physician and nurse, but also we have more than 35 subspecialty of the clinical pharmacy. Some of this specialty we are unique in the world, and we are differentiate from another institute, like for example the operating room clinical pharmacy, like for the pharmacogenetics and pharmacogenomics clinical pharmacist, the pain medication, nutrition, dispensing medications, IV prep, IV check, IV mix, all of the another subspecialty. All of them are participate and improve the healthcare quality for our patient. This is very important.
Are there any features of the metabolism and action of drugs in children that you should be aware of when selecting therapy?
Yeah, well, this is a very important question, because when you are dealing with a pediatric patient, there is a difference in the dosing of the medication, okay? So we can adjust the medication from the beginning, according to the weight, according to the body surface area. But after time, when you're starting chemotherapy medication, you have to check the drug-drug interaction, because this is very important to our patient and dose calculation. And you have to check about the dose modification, especially for the medication excreted by renal or excreted by hepatic. So you have to check about the renal function, about the hepatic function, and adjust the medication to prevent any other side effect for our patient and complication. So in 57357, depend on this information, we start the pharmacokinetic lab. Pharmacokinetic lab specialized to manage the concentration of the medication inside the blood after the dose of the medication. So we can start, for example, vancomycin. This is antibiotic or antibacterial agent. So after 3 to 5 doses of the medication administration, we draw the sample and measure the serum concentration of the vancomycin to ensure that the patient will be taking the specific dose with the specific concentration. In the advance, we start the pharmacogenetics or pharmacogenomics lab. This is called personalized medicine. We are the unique in the Africa, because this lab is starting how to personalize the medicine for our patient. Why this is important for us? Because the genetic factors is different from one person to another person. So the dosing of the medication will be adjusted according to the genetic factors from the US, which is different from our nation. So we start our pharmacogenomic lab. So the patient from the day one, during taking his medication, we draw the blood sample and measure and find the genetic factor for his patient. According to the genetic factor and the genetic variations, we found that some of the patients are normal metabolizer, some of them extensive metabolizer, some of them are poor metabolizer. According to these factors, we adjust the dose of the medication from the beginning. For example, if the patient taking the medication X and the patient, according to the metabolism of his medications, is poor metabolizer, according, for example, to cytochrome P45, 2D6, for example, and is poor metabolizer in these isoenzymes. So we found that if the patient taking this medication, we found that the serum concentration of this medication is high, so go to the toxicity level, then go to the ICU and increasing the hospital stay. From the beginning, we adjust the dose for this patient, for this medication, to minimum to avoid poor metabolization of this medication and avoid complication of side effect of this medication.
That's great.
Yeah.
How is coordination between the pharmacy and medical staff to provide cancer patient with necessary medication in a timely manner?
Okay. The role of our clinical pharmacist in 57357 is not to depend on his knowledge or his information about the medication also, but the clinical pharmacist is depend with the team. We have a healthcare providing team, or healthcare team, which including physician, pharmacist, and nurse. The pharmacists cooperate with another staff to adjust the planning of the medication. So the role of the clinical pharmacist starts from the protocol development. The clinical pharmacist make a round with the physician and nurse to select the medication according to his factors, according to the lab functions, according to the culture for our patient, and adjust the dose with the physician and nurse. And with the nurse, he adjusts and make sure the administration of the medication to make sure the avoiding of the some of side effect. For example, the most common side effect for pediatric patient is extravasation. Extravasation is very common for our patients. So the rule how to manage this kind of side effect, and this protocol, which is including the physician and pharmacist and nurse, to minimize and to improve healthcare quality. And this is one of very important factor for our mission, improving healthcare quality for our patients.
How is training and advanced training organized for pharmacy employees working in areas related to childhood cancer?
For the training, we have a cooperation with Harvard University, and we have for the clinical pharmacist make a cooperation with the Cleveland Clinic. Okay, yes, and we have a PharmD program. This is a very important program for our pharmacist. Then this is international program. In the Egypt, in the 57357, we have accreditation from SHP, American Society of Health System Pharmacists. And this accreditation, this is the only one in Egypt and the only one in the Africa. Okay, the hospital take these medications, this accreditation, sorry. By these accreditations, we introduce the IPPR, International Pharmacy Residency Program. This program for 1 year for the clinical pharmacist to participate and know how the skills of the clinical pharmacist and how to be very unique at the clinical pharmacy. And after 1 year, you take the certificate from the SHB. This accreditation will mean for the clinical pharmacist if you make a residency in 57357, which is equivalent if you make a residency in USA. Yes, and this is very unique. And we received a lot of the clinical pharmacist training from all over of the world, for example, from Spain, Portugal, from the US, from the Europe, from the Middle East, from all over the world. Yeah.
What automation systems and information technologies are used to manage the pharmacy process in pediatric oncology?
Okay. The HIS system for health informatics system of our hospital is Cerner system, one of the most powerful HIS system in the world. That help the pharmacist and the physician and nurse will be entered to the patient details and information, and back if you want to any another informations to manage. For example, for medication like doxorubicin, this is the anthracycline medication using for the osteosarcoma patient or for the acute myeloid leukemia. But for this medication, this is a cumulative dose for this doxorubicin. So the pharmacist, he have to back all of the years to calculate the cumulative dose of these medications. So the the Cerner system is very helpful for that, and very helpful for the research. If you want to make a retrospective study, you can make it through the system, and this is very good one. For the clinical pharmacy, we use the raw machine in the dispensing pharmacy. The raw machine in the dispensing pharmacy, we dispense more than 30 in the dispensing machine and the dispensing area or dispensing department, we dispense more than 3,000 doses per day, okay, for our patients. In the past, we are prepared by the clinical pharmacist, calculate the dose, and the pharmacy technician just make a preparation of the dose, and we are prepare the dose according to the tablet. We dispense for this patient 5 tablets, not the strap. We dispense for this patient 1 bottle, not 2 bottles. So we calculate all of them. But as you know that the pharmacist technician maybe have some of the medication error, and this is common in the world. So after that, in 2016, we start the raw machine. What's the raw machine? A raw machine is the machine using the AI, artificial intelligence. So it's only done by machine to prevent medication error and decrease waiting time during the dispensing. If you used the human factor, you need more than 45 minutes to dispense the medication. By this machine, you just need like 11 minutes. So this is very good for the quality for the patients and decrease the medication error. And this is one of the most brilliant dispensing machine in our hospital. Also, we have for the inpatient departments, we have the BICSs. BICSs, one of the machine used to prevent the floor stock for nursing and for the pharmacist inside the inpatient department. Also, by using this machine, just enter the MRN or medical record number for the patient and select the dose. This machine and this BICSs is integrated with our CERN system, so you can follow the medication for the patient and to confirm if every patient you have taken his medication at the right time, right dose.